Hey, it's Brian from Strong Tower Training, brain-based performance coach, and I'm back with part 5 in our low back series. So we're working today out of a chair, so you can get yourself in a comfortable seated position. And we've been talking a lot about finding positions of safety, positions that reduce threat for your low back, and also working on some motor control exercises, working on the eyes, working on the inner ear, because all of those influence our pain pathways and the potential pain output in the body, whether that's the low back or another area. So today we're going to work on a lot of motor control again through the low back and also getting the hips involved with this. So a lot of nerves that run through the hip come out of the low back, and if there is compression or tension on those nerves, sometimes somewhere in that pathway the brain can send a pain output. So if we take tension off the nerves in the pelvic area, a lot of times it helps out the low back and reduces overall threat. So that's what we're after today. I want you to start out with an assessment like we often do. We're going to bend side to side. Just test out your range of motion there, forward and back bend. So rounding the back and then arching the back. Get a feel for both the comfort, ease of movement, range of motion there. And then rotation, side to side with some torso rotation. All of these, we're keeping the hips on the chair anchored down there. And so the starting position here, we're going to cross and bring the foot up and across the other knee. If this is tough, you can always keep the leg lower down. You won't access as deep of a stretch, as much of a stretch in the hip, but if you need to start here, you can. You could gradually start to prop the foot up on some pillows or a footstool and work your way up as well. I'm going to show you starting out here though, a couple of the mobilizations that we're going to work on. So sitting up nice and tall, I'm going to start out by just gently pressing this knee down. And what we'll feel there is a bit of a glute or a hip stretch. So that's step one. Step two is gently pulling the knee up. And as we pull that knee up, staying tall through the spine, you should feel a little bit of a different stretch. So for me, it's a little bit higher in the higher area of the glute versus lower down with the press down. It might be slightly different for you, that's okay. And then same thing on the other side. Go ahead and gently press right above the knee, pressing that away through the thigh, and then we're gonna bring the knee up and across. So I like to keep these dynamic. You could do like 30-second static holds with these, but keeping a dynamic component of that movement is awesome. And also playing around with using your leg musculature, your hip musculature to push into the hand. So if I pull up into a stretch with my hands, I can also actively push my knee back down into the hands and do a little bit of strengthening work through the glutes and the other muscles in and around the hip. Go ahead and retest from there. Just see with that initial movement what you get as far as side bend, flexions, extensions, and then also your torso rotations. For me, maybe a tiny bit better, not a like, wow, amazing, right home about it type of thing. So this next one that we're going to work on is adding some motor control in the spine. And this is where, to me, it gets really cool and exciting as far as improving your brain map, improving your motor control, we know is typically a good thing. Surrounding joints, joints love receptor information. Your brain loves getting receptor information from those joints too. And if we lose mobility, you're losing some capacity for that receptor activity, mechanoreceptive and other receptors around that joint. So we're working on motor control now, which just means fine controlled movement. So the next one, we're going to get back into our stretch position with the hip. And then what I want you to do is gently push the knee down, and then we're going to glide the torso away. So I'm trying to take, primarily focusing on mid and low back, a lateral glide away from this side. So I'm gliding away, and then I'm going to push and pull up through the knee. I'm going to try to glide away a little more. If there's space for that, push and pull up through the knee. Maybe gliding a little more, push and pull through the knee, driving it away, pulling it back up primarily above the knee in that thigh area, so we don't press on the lower leg and create a lot of torque on the knee. It's more so stretching through the glute and the hip area with that. Same thing on the other side. So we're gonna cross, glide away, mobilize the hip. Glide more if there's space for it. Mobilize the hip. Great job. Keep breathing through these two. Glide away, mobilize. You may find too that as you glide away, you can also forward bend and get deeper into that hip stretch with a little bit of lateral glide, but also some forward spinal movement. And if there's space for that, feel free to add that in. The next is retesting, so see what you got from that. And for me, that becomes more of a, oh wow, that moves a lot easier through the back, through the low back. Specifically, almost to where I'm like, hey, should probably not go any further, I'm gonna fall out of the chair kind of thing. So hopefully something we did so far, either first exercise or adding the glide, started to help you improve range of motion. And if you're moving better, your brain's allowing more freedom of movement around that spinal column. The muscles are doing what they're supposed to be doing. They're contracting and relaxing synergistically with each other to allow you more freedom of movement. That's usually a good sign in the neuro world. In rare exceptions, like cases where somebody's hypermobile, they already have too much mobility, not so much the case. But a lot of times the clients that we work with are more on the things that are a little bit tight and they actually need to be mobilized and loosened up end of the spectrum. Not everybody, but most. So from there, we're gonna go into the leg cross again. One more for you today, and we're gonna add in a second movement. So this one does become a little tougher on the motor control side. So if it's challenging for you, just stick with it. Maybe visualize what that movement would be like if you feel like you're not getting a lot of it, and then work on the motor control over time. If the low back's not mapped well, doesn't have a good motor control capacity, that's one reason that the brain would increase threat, increase pain signaling in that area. It's because we don't have a good movement map for it. And improving the movement map often reduces threat, reduces pain levels. So we're gonna go ahead with this one sitting up nice and tall again. Start with the glide, and then we're gonna add a rotation. So I want you to glide and rotate away, and we're gonna stretch up and down, pressing down on the thigh and then back up. And then we could add more rotation, try a little more glide, and then see how that hip moves. Rotation, glide, and see how the hip moves. Same thing on the other side. So if you have the motor control and you're finding a little bit more space freedom in the spinal movement, awesome, because improving motor control through a greater range of motion is a good thing typically. Second piece of that is if it frees up the hip, that's another bonus. So same thing on the other side. We're gonna go ahead, sit up tall. We can start out rotate away, then glide away, then move that thigh up and down. Rotate, glide the back away from that hip, and a little bit of up and down stretch there. Rotation, gliding. Sometimes a little forward if there's space for it, forward flexion again. You could add that in and then move the leg. Go ahead and retest after that. And I hope that you found something that really helped your range of motion today, helped the spine feel better. If so, great time to go take a walk. Walking is such an innate pattern, part of human existence, that it can help cement changes into the nervous system. So if you found this useful and helpful, take a couple minute walk, 30 seconds even, is better than nothing. And then keep practicing. So neuroplastic change, we know, use it or lose it is important, and use it and improve it is also important. And those principles apply to neuroscience and neuroplasticity. If we want to change the brain, get it out of a chronic pain experience, doing this stuff really consistently is going to make the biggest difference. Again, use it or lose it. That would be somebody that lost the motor control in the low back. The good news there is use it and improve it. So if you practice this stuff consistently, you should start to improve movement in and around the spine, and that's going to pay hopefully long-term big dividends in your movement and overall in your brain health as well. Thank you.